Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. In recent years, we've seen several studies showing that supplementation with the natural health product known as Berberine can help to lower blood sugar and hemoglobin A1c in type 2 diabetics. For example, a study published in 2025 in the journal Diabetes and Endocrinology involved 113 type 2 diabetic patients who underwent 8 weeks of diet and exercise control. Now, after the 8 weeks, half the group were administered a berberine supplement of 500 milligrams twice daily or 1,000 milligrams per day, and the other half received a placebo in this randomized double-blind clinical trial. As we saw with previous studies, the group that received the berberine supplement showed a significant reduction in both glucose, which is blood sugar, and hemoglobin A1c levels, lowering glucose by 13 to 18 milligrams per deciliter and reducing hemoglobin A1c to under 7 in patients who were previously above 7. The berberine group also showed a reduction in the bad cholesterol, which is LDL cholesterol. There were no significant side effects from the berberine, and there were no negative effects on liver function. Now, studies over the years have shown that berberine supplementation works much the same way as the diabetic drug known as metformin, a very popular diabetic drug. So berberine, like metformin, is shown to reduce inflammation, improve insulin sensitivity to help clear blood sugar from the bloodstream, and it suppresses the secretion of LDL cholesterol and triglycerides from the liver by regulating liver function more effectively. In fact, studies show that berberine supplementation lowers important blood markers of inflammation, which are linked to berberine's ability to improve blood sugar regulation by improving insulin sensitivity. When you improve insulin sensitivity, cells can extract glucose or sugar from the bloodstream more effectively and use it as energy. Your blood sugar level goes down. As one research paper concluded at the end, and I quote, "The combined application of berberine in patients with metabolic syndrome, which is sort of a pre-diabetic state, can effectively regulate blood sugar or blood glucose and blood lipid in patients, alleviate insulin resistance, and reduce the level of inflammatory response in the body." So, what is berberine? Well, berberine is an alkaloid compound that's found naturally in many plants, including a group of shrubs called berberis. It has a long history of use in Chinese traditional medicine. In recent years, its ability to improve the management of type 2 diabetes has been shown in a number of impressive studies and very, very consistent findings. So in my view, type 2 diabetics and pre-diabetics should consider taking 1,000 milligrams a day of a berberine supplement to help improve their overall management. So I've included the references on berberine in the text below. Thanks for watching, and I'll see you next time.